Hi, welcome to your Checkup. We're the patient-facing medical podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited you can be here with us again today. All right. So we were cooking. I got off the night shift and
Here we go.
I was making a salad, and if you didn't think that spring mix, feta cheese, and avocado were a good mix, they certainly are. But, you know, I was trying to get the pit out, and I took a serrated knife, and I was holding it in my hand. I was cupping this avocado, and I put the serrated knife in the pit, and I'm cut. And then it slips, and it jumps and cuts my hand.
The kid acts like he's never cut his finger with a knife before.
Well, for me, this was novel. And it hurt.
Well, Eddie also has just realized that he can cook. So he's using more kitchen tools. So stay tuned for more injuries.
Yeah, well, that hurt. And I'm going to try to get the most genuine answers out of you here.
Out of me?
Yeah. What else hurts? When you first wake up in the morning, what do your feet feel like?
Well, depending on the day, it feels like I get out of bed and I'm standing on knives.
So, you know, I asked you this when we first, I don't know, we were just thinking about feet and getting up in the morning. Because when I would get up, I'd be a little stiff. And then I'd look over at you and you'd be wincing in pain, which seemed not normal. And then, I don't know, do you feel that? Where in your foot does it hurt when you first get out of bed?
It's like up by my heel.
Like on the bottom part?
Mm-hmm.
Oh, okay. How long did you think that was normal for?
Well, it's been a couple years.
And
this is actually the exact conversation that we had.
And does it stay like painful, or does it get better throughout the day?
It depends.
And now if you're sitting for a while and you start moving again, does it affect your actual ability to run at all?
Yeah, it does, because a couple weeks ago, you and I went for a run at the beach and I made it like a half mile and then I had to stop because it felt like I was running on knives.
Yeah. So you have plantar fasciitis.
I do.
Yeah. And that's exactly
the exact conversation that we had.
Yeah. And
well, I think it was like a little after we moved in together.
Mm-hmm.
And you like saw me every morning and you're like, oh, well, you're in pain every morning.
Why are you in pain every morning? Oh my God. Yeah. So that was, you probably figured that out a long time ago.
Yeah. A simple Google search will, not to be a Google doctor, but
sure.
You know, it's one of those like benign things that the internet will tell you.
Yeah. And this ends up being the most common cause of foot pain and heel pain in adults. And if you're listening, this has been happening a lot. Like, I don't know, people have been messaging me and saying like, oh my God, that was a soleus strain that I had. Mm-hmm. Or, wow, I got sunburned this week. This is really topical with all of the heat that's been going on, the summer safety thing, the heat wave. So it ends up being the most common, like I said, the most common cause of foot pain and heel pain. And literally like 1 million people probably go to see their doctor about this.
I didn't.
No, you did it. We talk about it a lot, but it's incredibly common. So when we think about the foot and we think about what the plantar fascia is at first, so it's this white tissue that is on the bottom of your foot. And if you're imagining from your heel to your toes, it attaches to the skin that overlies it. And it offers support to the bones and the structures in the foot that go from the heel to the toes. And the pain when plantar fasciitis occurs, and any time in something in medicine, something has an itis after it, that there's inflammation. So that's the leading understanding right now.
The itis.
But there's pain back on the inside, usually towards the heel. And so, here we have about like who this can affect most often. Is there a certain group of people that are affected by this more than others?
The peak ages are about 40 to 60 years old, but then even earlier specifically if that person is a runner.
Yeah, and there are some risk factors that are discussed in the literature, but these are a little wishy-washy. what are some of those that may predispose people to having plantar fasciitis?
So some risk factors of plantar fasciitis that were suggested are weight, heel spurs, and diabetes.
And there's also some conversation around if this is caused by micro trauma and overuse injury, which when you kind of look at it, gets at excessive training, especially increased in distance running, or maybe you're wearing, someone's wearing inappropriate shoes in terms of arch support and running on hard surfaces, or if they don't have as much flexibility in their ankle, like they can't dorsiflex or get their toes to the sky as much. And, this actually is pretty common in dancers as well, ballet dancers.
Yeah, they have a lot of feet problems. Do you ever watch like those TikToks or reels of they probably don't ever come across your desk, but they do mine of like ballet dancers who do like point and like what they like have to do to their feet when they dance and stuff. It's kind of crazy.
That is crazy. Do the shoes offer support to support them going like that?
And like the top of it, like they're different shoes.
Wow. Okay.
But they do all kinds of crazy things to like their feet and their toes to like prep their foot.
To like withstand that? Interesting. So I know we talked about it when we first got things started here, but as our resident content expert,
I'm a survivor.
And a survivor, much like I was with the calf strains, what does this feel like in your own words?
Well, I'll give like the textbook kind of description of what they say it feels like, and maybe if you're doing some of your own research. So it says pain at the bottom of your foot closer to your heel, which I would agree with, like knives on your heel. Worse in the morning and then better with activity. Worse with inactivity and then gets better kind of as the day goes on, which I also agree with. And then pain worse when you're walking either like in bare feet or just, like flip-flops on supportive shoes on a hard surface. And I agree with all of that. Definitely worse in the morning. Yeah, and then kind of as the day goes on, it feels better.
Yeah.
Until I like start running again and then it's a cycle.
I know it's a really frustrating diagnosis from everything that I was reading. And when you talk to these people who come in the office, for diagnosis, labs aren't that helpful. And honestly, imaging isn't terribly helpful either. The diagnosis is basically made by this history of heel pain that sounds exactly like what you're describing, and actually being able to have tenderness where the plantar fascia goes into the heel. And that can actually be used in treatment as well. So, but there are also other causes.
Press your thumb in my heel and I
I totally did that. Back. Yeah. And you were like, whoa, geez. And all this to say, in the nature of this podcast, that this isn't medical advice. There are a bunch of other things that can cause heel pain, which is why you specifically need to go to your doctor to have them take a look, because there are several other things. This just happens to be the most common.
Okay. So what are like the general universal treatment things that someone could be able to do? Maybe just like do at home.
This is the key piece. I'm sure like everyone who has plantar fasciitis is like interested in how can I get this to go away. And when we were reviewing for this show and reviewing different articles, it comes to pass that it's a really frustrating diagnosis. There isn't a lot of great evidence to support one over the other in terms of things to do, but there are several and they may or may not work. But let's go through them because each of them is important. And the biggest thing to take away is that about 80% of people who have plantar fasciitis will get better after 1 year. So that's an encouraging thing, that 4 out of 5 people will get better, right? Do you feel better about that now?
No, it's been like probably 3 years. So
you've fallen that small.
Well, I also haven't like really done anything to make it better consistently.
So let's talk about what we could do.
Because honestly, like, I don't know, it's like annoying and painful and inconvenient, but like there are worse things,
Yeah, I guess there are worse things. I mean, but you tell me this all the time, right? Like we can't compare to worse things. Rest and avoiding exacerbating activities is the first thing and maybe seems most obvious, but there's some evidence here that in studies where they looked at runners and they saw that their distance load, and if they, there's this study about general lower extremity body soft tissue injuries, and as people reduced their as people reduced the distance that they were running, they had fewer incidences.
That makes sense.
Yeah. So rest and avoidance is something that's important. Cushioned footwear is actually a really high point that, this is similar to the calf strain one. This is like a tangible takeaway that someone can go do and grab. If a heel cup, like a prefabricated silicone heel insert, actually may do wonders. There are certain studies where they took people with heel cups and stretches and just people with stretches. And the people with the heel cup and stretches did better overall.
Yeah, those did really help when you put them in my shoes.
Oh, yeah. And those
especially if they're shoes like that you are wearing like all day,
Right. Like every day, all day.
It's like shoes. Supporting your heel all day. Like if they're like what you wear to work or whatever, like in my sneakers that I wear to work and like I walk to work, and I think that helped. And
there's probably more to be said about the anatomy of someone's foot. Like if you have flat feet, that may put you more at risk.
Or a really high arch.
Or high arch, that may put you more at risk. Or if your shoes, like I wear shoes into the ground until they're falling apart. I bet a lot of people probably could afford.
That's your own personal problem.
That's my own personal problem.
You're supposed to change your shoes every 6 months.
Is that what they say?
Yeah.
Yeah. So like we're already up on that. And I feel like I just got these.
We got those sneakers 6 months ago?
Well, I don't know. Feels like a long time ago. But anyway, so those are two. And then for more significant pain, you'll obviously have to go see your doctor for this one. They do glucocorticoid injections for severe pain, or otherwise steroid injections, right at the site where people are tender. And sometimes you may need a sports medicine doctor or orthopedist or a podiatrist to do this. But I mean, if you have a bold, savvy primary care, they may do it as well. And there's some evidence that you can get some benefit with one or two, but how long, how many you need, they're generally safe, but that's a conversation to have with your own doctor. But if things really aren't going away, you're in a lot of pain, you can get a steroid injection as well. And lastly, I would say, in the nature of things that are totally within the realm of you being able to do at home, are stretching exercises to help with your plantar fasciitis. And we've talked about this. I mean, they're subtle and you can do them all the time. I guess the best way to think about incorporating these would be to pick one and do 3 sets of 10 and just pick a certain time during the day that you're going to do them.
And they're like all over the internet too. This is not like secret information that only doctors know. Like it's kind of, I feel like those stretches are like pretty universal and easily accessible, right?
Oh yeah. I mean, I'm just looking at pictures right now. Like one of them is literally massaging the area. The next is
that's the best.
Oh yeah. When I've been,
yeah, I'm actually faking it. So you rub my feet every night.
I'm seeing a calf stretch exercise here with a towel, where it's a longer towel. You're sitting down kind of perpendicular to the ground and you put a towel down and pull your calf because it's all connected. I'm seeing foot ankle circles where your foot's pointing out straight and you go counterclockwise and clockwise to rotate your ankle while it's straight.
And we can put some visuals on our Instagram too.
I'm seeing toe curls,
which that's a good one.
Perhaps the most subtle one.
No, I think that's like the biggest one, the most helpful one.
And I think the actual nature of that works is that you are crinkling your toes, so it's kind of activating the fascia a little bit, because that sudden feeling in the morning is because you're stretching the fascia by the nature of how your foot's going down to the ground, because when you've been sleeping, your foot's sleeping plantar flex, so your foot's down a little bit, like your toes pointed down. That'll get to the nature of one of the other contraptions that is advertised, but who knows if it actually works.
I think it does work.
Yeah, right? See,
I've been wearing it to bed when you're on night shift. It's not a cute accessory with my cute pajama sets.
And that we can talk about, like reading studies and stuff, because that's important too. But the toe curls are huge. And let's see what else we got here. Oh, you could just do it with a towel as well if you need to motivate yourself. And then unilateral, okay, one side. So I used some jargon there. One-sided heel raises, almost like you're doing with your calf raise exercises that we've talked about in the other episodes. And like I said, doing those stretches or exercises for 3 sets for 10 repetitions will probably give you something to work towards and help out. And also, they looked at studies, sorry to the physical therapists out there for this one, that doing it with the physical therapist versus doing it at home didn't quite make a difference.
Yeah.
So that's super convenient because you don't have to lug it all the way to physical therapy in a busy life.
Mm-hmm. And also for other like home remedy type things, I feel like I can say, because this isn't like advice.
Yeah, it's not, but this is like right up there. Yeah.
I really like, well, if you don't have someone to like actually rub your feet, like Eddie so patiently does anytime I ask him, pretty much on demand, you can roll your foot on like a tennis ball or a lacrosse ball is nice because it's like really hard and you can like lean onto the one side. Or I got on Amazon, it's like a double lacrosse ball. And it gets like both sides of your feet, and then you can put it vertical and just like stand on it. Oh, it feels so good. Or people like the frozen water bottle and then rolling your, which also that's like, duh, like if something's inflamed, put ice on it. Like,
but that's like the good way to put ice on it.
That's not like rocket science. Yeah. And then roll your foot on it.
That's awesome. There's actually some evidence here talking about non-steroidal anti-inflammatory agents. It's short for NSAID, which I'm sure a lot of people have seen, but also in terms of it's like ibuprofen is another medicine, or naproxen, which brand names are Aleve,
Advil,
or Advil. And short courses discussed with your doctor. And look, I'm not going to pretend like people are all healthy out there. Some people have conditions that actually they can't take these medicines, so you got to talk to them. But I'm seeing 2 to 3 week courses, which I haven't prescribed myself, but it seems like something that could be reasonable to ask about. There's a long list of other options and procedures that have kind of little benefit. The one I want to talk about, because it gets into like something that you can do at home, maybe if you're really motivated, you can do it. It's the night sock. And if you're going to look at, or a night splint, I don't know if this is a specific brand, but when I learned it from sports medicine, they called it the Strasbourg sock. Mm-hmm. What does that look like?
It's so cute. It's basically a like long sock, and you told me, the sports guy you were with told you it has to be the one that goes up to like your knee.
Oh yes,
because they'll have shorter ones, so it has to go up to your knee, and then it has a strap on it from your toe that then pulls up, and you like wrap it around your calf, and it kind of just keeps your foot flexed all night. And so then you're not like, when you're sleeping just regularly without anything, your like toes are pointed. Mm-hmm. So when you're sleeping at night without anything, whether you think about it or not, like your toes are more pointed, mm-hmm. and they're not in that flex position. And so when it's pointed, that plantar fascia is like stretched out.
Right.
And then if you sleep with it flex, it's like shortened, kind of, for like lack of a better description.
Right.
I think so. Then when you wake up,
mm-hmm.
this like thing that's causing you pain wasn't stretched out all night.
Exactly.
And it was kind of in the spot where it's supposed to be.
And that first step in the morning isn't the first time mm-hmm. in 7 to 8 hours that it's been stretched.
Yeah.
Which causes the pain inherently. So that's the logic behind it. Now, if you were to go dive deep into these, libraries of medical literature, they would give wishy-washy answers about whether these work or not. But here we are. We have you saying that they help, mm-hmm. right? I mean, and this is the nature of some medical research where a study is done to evaluate an intervention, but it doesn't necessarily speak onto how it would have individual benefit for a person. And so it's worth a try, right? Like, what do you have to lose? Because we're not recommending surgery. People don't usually get surgery for plantar fasciitis. And because most of the time it gets better after a year. So you've got a long laundry list of things to do and try before you even get to anything before steroids, You got to try all these things at home first, right?
Yeah. And they're easy.
They're easy.
Like you can do like a lot of the stretches when you're just in your everyday life. You can roll your feet. Like a lot of times I'll do it. Actually, our ball things in the kitchen. I'll do it if I'm like standing in the kitchen.
Oh my
doing
God.
whatever.
Is that what that is?
Yeah.
The green thing?
Or I'll do it like when I'm getting ready or like doing my hair. I'll just like roll my feet. Yeah, that's what that is.
Yeah. So all in all, plantar fasciitis is a really common, annoying, painful condition, but there's a lot to do.
Mm-hmm.
And I mean, you may be listening to this and you may think like, wow, I have this heel pain. I'm not saying you have plantar fasciitis. I'm saying you should go see your doctor and think about it because maybe you do, but you also may have several other things. And that's something we didn't talk about because the list is long and complicated, and that's not the point of this.
You can also use it as an excuse to get your significant other to rub your feet and be like, oh my God, I heard this on a podcast. They said it would make me feel so much better.
They included that massage actually helps. I mean, massage, well, what doesn't it help? Awesome. So pretty soon, keep an eye out because we're going to have a functionality where you'll be able to send us a text message through our show notes. And I mean, we're all ears. We're open to feedback. We're open to ideas because this is a long effort, and we do this weekly, and we'll see what other abilities we might have with our upgraded podcast host. But that's going to be one of the features we'll have access to, so we can better connect with you all. And we were so excited that you were able to come back with us today, and we hope that you learned something for yourself, a loved one, or
a neighbor.
And make sure you subscribe, rate, and review wherever you listen to your podcasts. Follow our Instagram, Your Checkup Podcast. And soon enough, we'll have a website. And so I'm really glad you came back. And please, most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.